It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. It looks like it's going to begin now, so let's listen in.
We will hear from Director General Son Young-rae of the Central Disaster and Safety Countermeasures Headquarters. We will be providing sign language translation. First, we will hear from Mr. Son Young-rae about the countermeasures against COVID-19. I will start the regular briefing for Sunday, April 25th. Over the past week, there has been some developments and I'll update you on it. Over the past week, on a daily average, there were 659 newly confirmed cases. Compared to 621 from the previous week, it was an increase by 38 people. Over the past week, the reinfection rate was 1.02, and this is slightly lower than 1.1 from the previous week. We are not seeing a dramatic increase, and that is very fortunate. However, we are still seeing the trend of increase in patients, and this is continuing. On a regional average, there are around 420 newly confirmed cases for the metropolitan area and around 280 for the non-metropolitan area. We have seen a lot of cases in Seoul and Gyeonggi area, and we are also seeing a continuous increase in Busan and Ulsan region. And there are around 110 people being newly confirmed in these regions. The medical system for treating patients still has room. Compared to the third wave, we have seen a decrease in those who were critically ill, and we did also secure a lot of hospital beds. In the case of December of last year, we only had 50 hospital beds available for those dedicated to COVID-19, and everyone had to wait at home. However, right now, we have around 546 hospital beds available, and there are no patients that are waiting to be hospitalized. And also for those that are critically ill, we still have room for around 54% at more than 8,000. Right now, the medical system is stable. However, we are seeing a continuous increase and the trend of increase in the number of patients. Therefore, we have to make sure to curb COVID-19. If we see a continuous increase in the number of patients, we will have to have stricter reasons such as banning gatherings and shortening the operation hours. However, these measures cause difficulty to many, and it also poses a risk on the civilian economy. Therefore, it is important for us to curb COVID-19 before we take such measures. Right now, the social distancing measure that we have taken will last until May 2nd, and we will make sure to come up with a task force team so that we can strengthen disease control. All central departments will have the ministers and the vice ministers going on site by themselves so that they can monitor the situation. And also they will ask people to adhere to the social distancing rules. And also we're going to have site teams so that we can have crackdowns on the local areas, and for those that are violating the rules, we're going to penalize them. And the police officers will also cooperate with us for the monitoring. For the governmental institutions, dinners or lunches taken together with teams will be banned. And if these are not adhered, we're also going to have ad hoc monitoring. We're also going to strengthen monitoring for the local governments, especially for the greater Seoul area and in the Busan and the Gyeongnam provinces. We are going to have the city mayors strengthen the measures as necessary. In particular, for the violations on the disease control measures, we're not going to tolerate any of them, and we're going to make sure to penalize them. And we're also going to monitor these numbers on a daily basis. And in order to make sure that this is not burdening the necessary people, we're going to send some people out for additional support. And we're also reviewing additional nurses being sent out to the local government areas as well. We're also going to strengthen measures for the private institutions and the business sites. When we see cluster outbreak in the business sites, that actually causes a great risk on the operationability. Therefore, we want to ask the business sites to closely monitor the situation and make sure to adhere to the social distancing and disease control measures. And Ministry of Labor is going to work together with a lot of the business sites. Yesterday, there has been disease control monitoring for more than 12,000 sites of 22 different business types. Starting in December until yesterday, we have seen 505 violations, and we have taken 2,100 administrative orders being imposed. And we're going to make sure to strengthen the monitoring and also the penalizing so that we can curb COVID-19 as soon as possible. We ask our citizens to cooperate with us as well. Yesterday, the government has secured purchase for 40 million Pfizer vaccines. This is available for more than 20 million people. So now we have secured around 43 million Pfizer vaccines so far. And in total, the number of vaccines coming into Korea has increased to 99 million. This means that our citizens can be vaccinated 2 times. And if we consider additional vaccines coming in, this means that we can get 3 doses per person. We have enough vaccines, and now we have to think about whether the demand and supply of future vaccines is possible. However, we should not have such discussions now, because such discussion is not really helpful for the disease control. Demand and supply for the future is as such, and there were some criticisms saying that our vaccination is slower than that of Africa. However, when we consider these countries, they are actually introducing vaccines from China and Russia that we have not reviewed. Therefore, it is not very fruitful to have such debates. However, at the same time, for AstraZeneca, there has been concerns that it is causing blood clots. Therefore, there were some criticisms about that. However, in the case of UK, half of those that were vaccinated were actually vaccinated with AstraZeneca. And experts also said that blood clot is a very rare disease and rare side effect. There were also some confusions about recovering daily lives due to vaccination. In the case of UK, sports facilities and bars are resuming operation. However, theaters are still not being operated, and social distancing measures are being alleviated in a timely manner. However, this is something that we have continued over the past week, so this means that we actually have a safe environment from COVID-19. Therefore, we don't really know how safe we will be when we get vaccinated. Therefore, we will have to take after the cases from overseas. With the long-term presence of COVID-19, the government is responding in 3 ways. In case of a disruption in the medical system, we have to make sure to prevent several millions of people being infected with COVID-19, and we have to protect our citizens. Right now, our fatality rate from COVID-19 is 1.52%, so we believe that we are actually meeting our goals so far. And also, we actually didn't have to take a massive lockdown, which would have caused difficulty to the vulnerable class especially. The lockdown that we see in US and in other parts of the world can actually impose a great risk on the vulnerable class. And also, we are trying to ensure the securing of safe vaccines in a stable manner so that we can resume daily lives. In order to do so, until end of June, we're going to actually vaccinate those in the vulnerable class and those who are elderly. So we're going to finish first dose vaccination for 12 million people until end of June. And we actually have proposed to have the second group being vaccinated until September. Right now, the first step is in progress, and we are vaccinating the elderly and the vulnerable class. And it is very important for us to keep COVID-19 at a low level, so we want to ask for your understanding. We also want to make sure that we can vaccinate people without much trouble. Until end of June, once we can vaccinate the elderly, we're going to have the elderly being able to move more freely around, and we believe that it will be safer for them, and we believe that that will in turn cause a safer environment for our society. Therefore, we want to ensure that our citizens resume their daily lives as soon as possible. We will make sure to make such efforts. Thank you.
지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for being with us. Arirang News will be back at 6 p.m. Korea time. Bye for now.